Entrustable Professional Activities Pilot Project, supported by the American Association for Endocrine Surgeons. In this short presentation, we will be introducing Entrustable Professional Activities as an assessment tool for endocrine surgery trainees and discussing how you can begin using EPAs at your training program. As the concern for general surgery residency graduates' preparedness has developed in recent years, so have explorations into the feasibility and techniques of implementing competency-based assessment paradigms. ACGME milestones, the current gold standard in assessing resident competency, serve as developmental benchmarks toward achievement of the core competencies. The ACGME defined the 6 core competencies for physicians back in 1999. Many training programs took these 6 competencies initially and put them directly on their evaluation forms. And while medical knowledge and patient care are fairly intuitive, and most faculty generally understand how to assess communication skills and professionalism, few could confidently assess systems-based practice and practice-based learning and improvement. This led to the development of milestones within each of these domains and recognition that these things must be integrated together while caring for a patient. Entrustable professional activities, defined as an essential task of a discipline that an individual can be trusted to perform independently in a given context. Answer call for a more practical measure of competency acquisition, as milestones are backward-looking and cannot be evaluated after a single encounter. EPAs evaluate at what level an individual can be trusted to perform independently in a given context. Previous work has provided validity evidence for the use of EPAs in general surgery residency as a complement to the traditional milestone assessment paradigm. Surgical faculty interact with learners almost daily, and in each of those interactions, often without even realizing it, they make a judgment about how much they can trust of what the learner tells them, and how much they will have to go back and verify. Or in the context of an operation, how much are they going to let that person do in the case? We do it automatically. It's part of our daily routine, and part of the job when functioning as a surgeon at a training program. A holistic view of the question that we could ask about this for any given encounter with a learner is, how much would you trust them to perform this task if you weren't there? Endocrine surgery EPAs specifically target activities within the field that have been deemed most critical for trainees to master prior to the completion of their AAES fellowship, and align with what we would expect graduating trainees to be able to do in practice. EPAs are grouped by organ system and address competencies in one or more phases of care. After completion of a core endocrine surgery activity in a preoperative, intraoperative, or postoperative phase of care, faculty and trainees will be asked to rate the amount of supervision the trainee could be trusted with if faced with the exact same scenario in the future. It's not how they were trusted today, it's forward-looking into the future. Twice per year, programs will be asked to review the EPA assessments that have been collected to determine the general entrustment level the trainee is at based on the data collected so far. The endocrine surgery EPA pilot uses the MyTip Report platform. The mobile app can be downloaded from the Apple App Store and Google Play Store. This makes completing assessments easy in real time and allows notifications for when an assessment has been requested. Setting up faculty and learners in your system is easy via the web application at mytipreport.org. And this can also be used to provide trainee ratings. Please note, both fellows and residents can be added as a learner in the system, and fellows can also be added as faculty if they are in a position to evaluate trainees as well. After completion of an endocrine surgery activity, the trainee will perform a self-assessment and request an evaluation from their faculty member. The faculty member will receive an alert that an evaluation is pending. Faculty can also initiate an assessment on their own, which then triggers a mirrored assessment from the trainee. To initiate an assessment for a trainee, the faculty member will log into the app, select their trainee, and the activity they performed. They will then rank their overall performance, which will be made available to the trainee for viewing. This puts trainees in the driver's seat to understand their current performance level and how they can improve going forward. Previous work in EPA assessments in general surgery has yielded positive results, with positive trainee feedback on the ease of the assessment system and the availability and accessibility of the feedback they receive. Thank you and happy assessing!